I've been asked to shorten the introductions as we're running short of time, so I shall just like to invite Dr. Eugene So, Doctor, Professor, CEO, and Chairman of the Center for Healthcare Innovation Co-Learning Network to the stage. He will be the chairperson for our panel discussion, The Healthcare Workforce of the Future.
Hi, very nice to see all of you here this morning. Thank you for joining us on this exciting day where we have some really brilliant people in the house with us today. Brilliant because they are not only helping us learn, but they are doing really wonderful work back home in their countries. So I'd like to invite a few people up on the stage. First and foremost, our Deputy Secretary, Ms. Teoh Woon. Please give her a round of applause. Göran, Jonathon, if I could have you join us back on stage, as well as Sir David Dalton, please. I'm going to try to keep the introduction short, but what I would like all of you to do is, if you have the Mice Pad app on your phone, that you will start keying your questions now, so that we could get to as many questions as possible during this panel discussion. First, I would just like to briefly introduce Ms. Teoh Woon. I think she's no stranger to many of us in this room because she has worked personally with many of us. She's Deputy Secretary of Development in the Ministry of Health. She also runs the Aging Planning Office. And through that capacity, she's really our bridge from healthcare into social care. And I have worked with her personally, and I must say that the work with her has been extremely meaningful, and really we hope that she will stay at MOH for life. Thank you, Zsin. She nodded. Do you record that? Yeah. Well, I would also like to reintroduce Sir David Dalton. Sir David Dalton was our keynote speaker yesterday. Sir David has just taken on a role as Chief Executive of the Northern Care Alliance, which really merges two huge NHS trusts together. And he's really transforming healthcare at the systems level. And it'd be really wonderful for us to hear from him again today. So Sir David, welcome back. And Jonathon and Göran, it was really inspiring this morning to hear both of you share your thoughts with us. Jonathon, on large-scale change, I love your 8 blocks and how we're going to tackle those 8 blocks to large-scale change. I've known you for a long time as well, and it's been fantastic, this journey. I remember seeing you at the corner of a room when we visited Koawate and Counties Manukau. And I remembered that together with the AIC, and I saw this gentleman sitting in the back thinking very hard. And when they introduced you as the Executive Director for Koawate, I was immediately taken with the idea of what you have created in terms of a learning network. So thank you very much for joining us today as well. Göran, 10 years, right? It's our 10th anniversary.
Yes.
So wonderful. The first time we went up with Swetwen, I remember that Nelly Yeoh and the whole gang from the National Healthcare Group to visit Jönköping for the very first time. It felt more like a pilgrimage. And today we have the pastor with us today, and we're very delighted that you can be here and you can share your thoughts with us. So the topic for today's conversation is really around the workforce. We are really focused on the people we have here in this room, transforming care with us. And when we look at that, yesterday we heard the Minister of Health shared very much about the needs for workforce transformation, for better skills, better work, and ultimately innovating our healthcare system together. And when we look at that, we have today 96,000 people in this small little country working in healthcare. And if we were to continue the way we work, we will need to double that number in 10 years' time. So if you think about that, that is really not sustainable for a small country like Singapore to have a huge proportion of people, 1 in 13 working in healthcare in 10 years' time. And what we are hoping that we can do is quickly to change that model and to look at how our people can have more meaningful work and meaningful ways of delivering care. And I think that is really the context of this discussion here in Singapore, but really we would like to hear from you and what is happening back home in your respective countries and health systems. So one of the things we see is a big shift into the community. And there is this big fear about healthcare people going into the community, like bulls in a china shop, right? We go in and we prescribe what needs to be done. But then we are hearing new ways of doing that from other countries. It reminded me of a conversation we had yesterday, where I shared that it almost feels like a little bit of deja vu, because we say we need to go into the community. But healthcare really started in the community. Healthcare was very personal. It was about the people. It was never about the disease. And then we put it into buildings. And now we are trying to make that transition back into the community and relearning some of the things we knew from the start. I love Jonathon's example about the Romans and what we can learn from them. It seems like learning from the past is also an effective way to learn about the future. But the future here offers us some new tools from design thinking to digital health to social media, all right, and new ways of tracking healthcare out there in the community. And I hope that will also transform the way our workforce starts thinking about delivering care. So with that context in mind, I wanted to hear from each of you and really to start today's conversation around how would you envision the workforce of the future? And to put a mental model to this, in 10 years' time, how would you see the workforce working within healthcare, with social care, in the community, and back in our hospitals as well? So I'm very happy to invite anyone to start first, but I would really love to get to everyone before we take the questions from the floor. If your mic is the switch.
Hello. Okay. Since I think the gentlemen have worked very hard this morning, maybe I should start off putting a local perspective to healthcare transformation and workforce transformation. I was sharing with Eugene just now that I, as somebody who is not too old in the healthcare sector, this is my 6th year in the healthcare sector, to me, the game changer for healthcare transformation is well out there in the community rather than in maybe as much as change within the healthcare sector. And I also strongly believe that healthcare transformation has to be driven by workforce transformation. Because if our people and the way we work do not change, then healthcare transformation will remain a slogan, right? The 3 Beyonds will remain a slogan. And therefore, as an administrator, how would I see sort of the healthcare workforce of the future? Perhaps to summarize briefly, 3 R's. First, recalibration. I think if we want to go beyond healthcare to health, beyond hospital to home, then at the systems level, we need to recalibrate the distribution of manpower between what we traditionally see as the acute sector and primary and community care. And I think that's very much reflected in the work that we have done in the last year with our nursing leaders. I'm very encouraged by our nursing leaders who appreciated that care transformation needs to be underpinned by the transformation of our nursing workforce. So beyond recruiting more, training more, I think the nursing leaders are saying that it is also about doing more, perhaps with less, through redesign of work in the acute sector, not just that we'll be able to keep up with the demands going forward with the lower nursing workforce, but more importantly, to be able to free up resources to start up new capabilities in the community in the form of community nursing. So recalibration of what is our portfolio and the distribution of our healthcare workforce between acute and community and primary care. The second R, I would say, is redefine what the healthcare workforce is. Eugene sort of mentioned we just now. Actually, the healthcare workforce is not just we versus the community, which is them, right? I hope, and increasingly the future is here. We are already in several communities on the ground. The healthcare workforce, it's the patient, it's the family, it is our neighbor helpers, it is my PG ambassador, as much as it is the community nurses, the doctors, the allied health. And that, to me, is the healthcare workforce of the future. So redefine what the healthcare workforce is. The third R is actually, I would say, retooling. I think all of us, relearning and retooling. First, it has to start with reframing. I still haven't gotten used to the word patient for so many years in the healthcare sector. In the community, we always refer to them either as our seniors, our dearies, our citizens, but not so much our patients. Some seems to suggest that they all have to be very patient with the healthcare sector. But I think to reframe, what are we here to do? We are here not to fix. We are here to enable. It is about health and happy living. It is not about sickness care. So reframing that, I think, is very important. Being able to retool such that we appreciate what it means and have the confidence to work across, not just with our colleagues, but also with the other sectors. And finally, retooling in terms of the usage of technology. So my ideal healthcare workforce of the future is everyone. It's in the community, and it is about a workforce that's working for better health, better life.
Thank you, Zsin. I was going to jump to Göran.
Okay.
And to take a learning approach to all of this, could you share with us in Sweden what has been done and how do you see the workforce changing there?
I think that my second picture with my family and me in different roles was a kind of message for this question. You remember I took the leadership for these people coming from different places in the world and supporting them so they can have good lives. And then I was a learner with my kids, and they told me what to do and understand. And then I said that I was a butler with my mother and serving this group of old ladies a good Saturday in the sun. Now, for me, this is very crucial. Is it possible to be a professional in healthcare and change roles like this? I think that one of the key issues is to be a team player. And in a team, you cannot act the same way because you have a new team member every week. So shifting the functional role within the team will be very crucial in the future, because the work in the community takes completely different actions where our medicine knowledge will not be the key knowledge. It's one of the knowledges. Combined with another thing that I see is a big, big challenge for us, and that is where and how we learn. Most of healthcare people learn from the same profession, but the older ones. So we still have a learning circle that depends on the same profession. So we learn vertically. But I think that the speed of change in the society needs a profession that learns lateral, The doctors have a chance to do that as consultants and second opinion persons in many situations. But 90 or 85% of the professions never come into that situation. They are in the same box all the time. When United States was in Afghanistan having a war, they suffered so much in the beginning because they had a group definition that was based on a hierarchy in the group. So the person lowest in the hierarchy had to ask the person over him if I'm allowed to talk with someone outside the group. The other armies in Afghanistan saw how stiff they were. You should read the book that is written by General McChrystal that describes that he had to change the view of what is a group and make everybody connect with everybody that is needed. So connectors was the key quality. And I think that tomorrow's workforce have to be encouraged to be very good connectors.
Jonathon?
Thank you. Just a couple of thoughts from me. So my training is in clinical genetics, and I think that helps me think a little bit about the future, because as many of you will know, the future's arrived and it's all around us. It's going to continue, of course, but it's fairly, it's putting a lot of pressure on the system as we think about how we cope. So a couple of thoughts from me on our workforce. I'm still trying to keep my head focused on the fact that our task is to look at what our citizens want, what their expectations are, and then exceed them. So we mustn't do this just to patch up the gaps, to hang in there. We still need to exceed them. So a couple of examples of what we've done over the years in clinical genetics. My own area of interest was in cancer genetics, so most of my work was with young individuals who had developed cancer very early, working with them and their families about their risks and their surgical and other options, which was really, really stressful for them and for us. And as a new issue that had hit us, we couldn't do this before. We had to design completely new systems and offerings for people. So I ran for a number of years an MRC study looking at what do people want, both in where they receive care and who they receive it from. And it's fascinating, you know, what we think we need to provide is usually wrong, in my opinion. So in that study, we tested, do you want to receive the information about your cancer risk in a hospital, which might be perceived as very prestigious, or in the community, or in your home? And who do you want to receive it from? A doctor, a nurse, or somebody else? And the answer, when you look at models like willingness to pay and other things, was people didn't want to see me. They didn't even want to see the nurse. They wanted to see a counsellor who knew them in their own local environment, and to exceed their expectations, they wanted something completely different from the current model. And that forces us to generate that, and I'll come back to that very quickly in a second. Another example, so I think of that as changing role. The next one is changing people, the people who do things. So genetics is driving us to do testing and sampling on many more people than we've ever done before, and different sorts of samples. We take biopsies, we don't put them in formalin. It's destroying the whole pathology system. Now, we have run out of pathologists in the UK. We cannot get enough of them. We can't get enough to do the sampling. So we've introduced a new person called a biopsy technician. Fantastic new role, we're training them. But of course, it's been hugely resisted by my profession, by the medical profession. And that is holding back the future because we cannot introduce that. But we must change the people. And the third thing I would say is changing the paradigm. What my citizens wanted who worked with me. And I like citizens. It's an old word. It means we stand together. The people that we stand together with in delivering health, they wanted people in their own community to give them the knowledge about genetics. So I mentioned it yesterday. I think we shift this completely around the other way, and I think it's auntie on the street corner. It's the sister, the mum, the gran, or the dad, or the uncle who has an interest in genetics that we should train in genetics in each community so that people can access it where they live from people they know. It's not nurses, it's not doctors. So I think we turn it completely on our head and we deliver that through our community members. Thanks.
Thank you. You mentioned a real shortage of in the workforce, and that's what the UK has been experiencing for many, many years. But it's been okay. We've gone over to Spain, to the Philippines, to Australia, and now to India to recruit. But the pipeline is about to run dry. So we have a real problem in the UK, and my understanding is that we share that problem worldwide. So we can't continue with the same model of workforce that we've got, even though the pressure is on us to employ more and more to meet the needs of the people. So our way of working has to change, and I think there are three issues, and colleagues have referred to those in new roles, often new supportive roles as associates or assistants. Technical support to knowledge experts. We will see, I think, a fundamental breakdown of the of knowledge being held just by limited numbers of individuals, and these individuals will then have to supervise their associates and assistants. I think that we will have to support the workforce to get used to working with machines and robotics and artificial intelligence and decision support, and that will be a change where knowledge has been held by practitioners who have decided themselves what it is that that they should do in the interests of people. They're going to be prompted now to think. Before they act or prescribe. But I think the biggest change is that's been referenced many times now, and that is helping and supporting the workforce to let go of the power that they have held onto for decades as the knowledge experts, and to see this shift in transferring that knowledge to the people who actually have it about themselves. They may not be the technical experts, but they have much of the knowledge about them themselves. And that requires a workforce to become not directive and not prescribing. That will still be necessary, but to also develop skills in coaching. And I don't think we're ready for this yet. I don't see many courses that I have a responsibility for in coaching or getting our workforce to acquire those coaching skills. And I don't know how you regulate it either. I mean, in our country, we are obsessed with regulation and inspection and assurance. I don't know how you regulate coaching. But I'm sure somebody will come up with a new system. So the transfer of power, I think, is what we have to manage now as we support our workforce through the change.
Thank you. Well, I'm going to get to a few questions that have come up online, and I'm kind of just going to group it together in the interest of time. And so there is really a series of questions talking about the fact that the young staff today, as well as those who are working in healthcare, feel fairly fatigued. They feel very busy. And really, how do we excite them about what the future can hold? There are also questions around the different cultures in which we have between perhaps countries in the UK, in Sweden, versus here in Asia, and that there is a difference between how we engage, whether is it through reason, is it through authority, or are there new ways of engaging our staff that perhaps we could learn from each other? Any thoughts there? Anyone?
just to push back really. So I've been working in our National Health Service for a long time, 38 years I think. And most years I hear people say that it's never been so busy, that they are tired and fatigued, and that morale is at the lowest it's ever been. And then I hear it the next year, and the next year, and the next year, and 38 years on I still hear that this year is so bad. Well, actually the data does not support what people are saying. When you look at satisfaction surveys that are done in organisations or done in countries, it says something else, that people still find their work enjoyable and report that. And if you were to plot this, you'll see that there's just normal variation that's taking place. But what I do think is important, that as the years change, and as we've been hearing in the last two presentations, we've got to prepare the workforce to know what it is that's expected of them. And that's the role of leadership, to be able to give clear sense of purpose to individuals and to teams. So that's never ending. It's leadership can't be obsessed with the present and the here and now. It's got to try and make sense of the future, because where people say they're unhappy, it's often because they're anxious about the change. They're not quite sure what's expected of them. So I just want to push back a little bit to say, next year you'll be saying you've never had it so bad, and the year after you will. But I think it's just being clear about what it is that you're doing and is expected of you.
For me, the answer on the question, what is success, is very crucial. If you think that success is that you see that your method has worked every time, then you feel stress, because for people, they take for granted that the method works. It is how their lives can be lived that are the key thing for people that use our professional knowledge. So I think the stress comes from the gap between what I believe is my work and what the customer think is a good service. And I don't think that is cultural. I think that is a question of professional approach. We have problems with too much of an authorized approach, that people should be satisfied with what they get, but that cannot live in tomorrow's world, because we will have thousands of Sara to begin with, and then we will have people with very severe health literacy problems that we really need to get involved with to help them to stay strong and keeping an active life. So the relationship, as you, Eugene, mentioned for me, was the key, will be tomorrow's secret, together with how we build interactions. You remember Bill Gates' view of things.
Thank you. I was going to say something that probably falls somewhere between both of the last two speakers. Edgar Schein reminded us that leadership shapes culture, and I keep coming back to the idea that it's a leadership issue that everyone in this room has to own. I'm, like many of you, when I'm talking to frontline colleagues, it is incredibly hard to stay motivated, energized around a 4-hour or a 6-hour target, even though we know it's really important. And I think the leadership challenge that comes in there is, how do we lift it to the bigger picture, that sense-making for the whole picture? So I get excited every morning about waking up because I think my job, probably linking to Göran's answer, I think my job is to save 1 million healthy years of life over the next 2 years. I want to address inequities. I want to be part of something that's really exciting. And that gets me out of bed on the morning. Now, part of that will be solving the A&E admission, working on the pathology turnaround times, working with GPs about safety and practice issues. But that's not what gets me up. What gets me up is my leaders who work with me and keep reminding me of what that really big aim is. And just to link that back to what Eugene said, I suspect from the years of wonderful work with you and others that we all share that desire to want to be connected to something that's really big, hairy, audacious, and will make us all get out of bed every morning.
I think I appreciate actually the kind of intensive work that our colleagues are working in the various institutions day in, day out. I think sometimes the medicine to cure that sense of fatigue and burnout is really the excitement of understanding what change you are making. Are you just building a cog, or are you building a car? And I once have a healthcare leader who has been both in the ILTC sector as well as in the acute sector. And his advice to young doctors who tell him that, my gosh, I'm going to call it a day. And his advice is always, go and do a ward round. See the patients that you are helping. And it's the same thing, I think, for many of us. We work on the healthcare system every day, 9 to 5, but it is also about that sense of purpose when we do our home visits in the community. So go do a ward round, whether it's in the hospital or in the community, and rediscover why you are in your job. Yeah.
Well, thank you very much. I know I've overrun by 7 minutes, and I would really apologize to everyone else here for not getting through to the nitty-gritties of all the questions that we have today. But I would like to say that the comments that the panel has made has largely covered most of this in some detail. And I would say that, listening to all of you, that there is such thing as a bad fatigue and a good fatigue. And yesterday night, after our very interesting and thoughtful conversations that we have had, I slept very well despite being very tired. And I thought it was a good night's rest for a good day's work. And I think I would like to end with a quote from one of my favorites, Peter Drucker. And he said that the purpose of any organization is for ordinary men like us to do extraordinary things together. So on that very note, please join me in thanking all our speakers here today and for sharing their thoughts with us. So thank you very much.